All right, so here are some of my reflections for tonight. I'm going to try to do this on a regular basis. So, to share my thoughts for the day, kind of the thoughts from the therapist. And so today, one of the thoughts I had was when we talk about negative self talk. Sometimes when we have been practicing believing certain things and saying certain things for so long, it creates this neurological stronghold, essentially. You may have heard the concept of having strongholds. Well, we now know through neuroscience that literally it creates this like groove in your brain that becomes our go-to reflex when it comes to our thoughts. We have the thoughts we go to and the self-talk we go to. So what happens is we over-identify with those beliefs and those talks because they are so frequent and they occur so often. We just start to say, that's just who I am. But I'm here to suggest that that's not who you are. That's the programming that has been spoken over you that we have ended up believing and making agreements with, and then having self-fulfilling prophecy. So when you go to therapy, what we do is we really work on changing that and opening up the new neural pathways of new beliefs and new self-talk. But here's the thing. It is so hard to do that. The analogy that came to me today is that it's equivalent. Let's say you're a right-handed person. It's equivalent from teaching yourself to go from right-handed to left-handed, to be able to write as proficiently with your left hand as you can your right hand. Well, we know with the neuroscience that if something happened to your health to where you can't use that right hand anymore, then we end up being able to use the left hand and use it as artfully and masterfully as our right hand. And we can even teach ourselves to be polydexterous. Look at piano players. How are they able to do it? They're left-handed or they're right-handed, and yet they can use both hands equally as skillful as they developed the art of playing the piano and they practice. Now their brain can do it. So this is your beacon of hope. What you believe that you cannot do and that's not possible for you because you haven't practiced it, you haven't rehearsed it, you didn't even know your left hand existed. When that happens, we just get stuck in this belief system that does not serve us. So whatever you are setting out to accomplish, to do, that you want to transform your life, you want to transform your health, your thoughts, your beliefs, even if you consider yourself a pessimist or a realist, there is a way. And we need skills, we need tools, we need methods, and after we get them, we need to put them in practice. So essentially, like let's say you come to me, you take my class, one of my master classes, or you are actually seeing me in my practice, I will equip you, and then you'll get that head knowledge. But if you walk out of here and we don't practice it and you're not held accountable for it, eventually we just kind of go back to the way it is. It's no different than going to the gym when you decide, I want to be fit and healthy, so I'm going to go to the gym and start doing that. It's not much different when we're dealing with our mental fitness, our emotional fitness, and our behavioral fitness. So we need to hit the gym on a regular basis and have that accountable presence that will walk you through it when you're feeling discouraged, when you're feeling weary, when you just don't think you can. You need that cheerleader. You need that coach that's going to push you through it and say, don't give up. Keep going. The end is possible. You will go to the finish line. We can do this. We will master this. We just need to practice. And over time, it becomes your second nature. And you'll start to say, yeah, I'm just doing it. And you might even forget about when you couldn't do it or how hard it was. You're going to get historical amnesia, where you may forget the battle of the mind that you had, or at least the level of intensity it was. Sometimes when I talk to people about the prison I was in my mind with my eating disorder and with my body and my weight and how paralyzing it was, where I wouldn't go anywhere in a bathing suit, I wouldn't go to an edge of a pool without covering myself and then slithering into the pool and leaving the towel on the edge. The shame that I felt, it was just absolutely paralyzing. I mean, when I went to the grocery store and buy my food, you would think that I was buying lice shampoo or some sort of hemorrhoid cream or something, and you're like, oh gosh, I don't want people to see that I'm buying this because I don't want them to know that I have this health condition. Buying a bag of chips evoked even a stronger response than that for me. And now it is a non-issue. I think I could even be a nudist. I mean, I'm not going to, so don't worry about that. But you hear what I'm saying? Like, it's just a non-issue. I have full acceptance and I have full freedom with my food and my body. And I forget sometimes how paralyzing that was for me. So you too can get to that place where you get to a place of victory over your circumstances that you cannot even imagine possible. Couldn't have imagined having that kind of freedom earlier, but I did, and you can too. So that's what I want to share with you today, and I hope that you are doing well. And guess what? I have some master classes coming in the new year. So please sign up for my master classes. Come over to my website and sign up on my newsletter, or if you're on Instagram, go over to the link that says masterclass, and it will take you to my sign up. And if you're here on YouTube, then just go ahead and subscribe, and then go to those other places and join me. Come to my website, and I would love to have you there, because now everybody gets to have my lessons and my classes, not just my clients. I'm so excited to bring that to you. All right, that's all I have to say. I'm Dr. Shawn Horn, a clinical psychologist from Spokane, Washington, and I'm signing out. Hope you have a great day, night, whenever you're watching this. All right, bye-bye.